Hello and welcome back to Fleetwood Area High School's election coverage for the 2016 presidential election. My name is Tristan Spanik. This period we'll be focusing on healthcare while 5 classes visit the library to vote representing the states of Georgia, Alabama, Florida, South Carolina, and Washington, D.C. Before we check in on the scene of the library, let's go back to the results of the 8 states that voted last period. First up is New York, represented by Mr. Kachanan's second period class. Those 29 electoral votes have been awarded to Trump, with the final vote of 13-5. Trump will claim North Carolina and its 15 electoral votes. Ms. Rankin's second period class voted 15-4, placing the Tar Heel state firmly with Trump. Moving on, we have Mr. Carr's second period voting for the home state of Pennsylvania. Tiger TV is confident in reporting its 20 electoral votes will go to Trump by a margin of 1. Ms. Nagel's second period represented Delaware and went for Trump in an easy victory. Virginia, 13 electoral votes have decided by Mrs. Hefner's second period will go to Trump by a 9-8 margin of victory. Ms. Jarosinski's second period voted for the state of Maryland. They voted 9-6, giving the 10 electoral votes to Trump. New Jersey and its 14 electoral votes, represented by Mr. Weiss's second period, voted in favor of Clinton by a margin of 10-5. Finally, faculty voted last period, representing the state of Connecticut, and its 7 electoral votes went to Hillary. A lot of states voted last period, so let's look where we stand. There's a lot of results being held by only 2 periods, by a total of 137 electoral votes handed out already. Trump currently has 90 votes and Hillary Clinton has 47. Still plenty of margin for the nation for those to go up. For now, Bianca Javaria is on scene again in the library. Bianca, what do you have for us?
Thanks, Tristan. I'm here with Mr. Carr. His class is representing Georgia. I wanted to talk about healthcare with you. 50% of those polled in New Hampshire see healthcare as the most important issue. Do you think the price increase in Obamacare will affect a person's voting choice?
I do. Right now, healthcare is absolutely one of the biggest issues that people face. And so when they're going to the polling booth across the country, they're going to be factoring that in as a reason why they need to vote for whichever candidate they think is going to be best for their families.
All right, well, you can head that back to Tristan. Thanks.
Okay, well, thanks, Bianca. Moving on to this period's panel. Okay.
More this way?
No.
You're good.
Thanks, Bianca. Moving on to this period's panel discussion. Just to review, each period will be welcoming 2 student experts who've done extensive research on the topic of the period. They are here for a conversation on real issues, and the points that they argue are not necessarily aligned with their own political views. This period, we are welcoming back Ripley Place, representing the Clinton campaign, and John Sanchez, representing the Trump campaign. Thank you for joining us this period. So this period, we're addressing the issue of health care. Let's take a look at both candidates.
I want very much to save what works and is good about the Affordable Care Act. But we've got to get costs down. We've got to provide some additional help to small businesses so that they can afford to provide health insurance.
Obamacare is a disaster.
Let's start with Ripley this time. Hillary is proposing the changes that fix Obamacare. Trump is advocating to repeal and replace it. Which approach do you think is better for this country's health care?
Thank you, Tristan. That's a great question. So I'd like to start by talking about what Obamacare has actually done. In the past 3 years alone, it's provided health care to 26 million Americans, and Hillary's plan is to change it so that it is more affordable for people and more accessible. And in doing that, that would make it better for people who are receiving it, and that would make it better for the public who does not receive health care. Because this is a program for people who don't fit into private categories or other categories where they would otherwise be able to get health care. So her plan is to fix it by lowering costs and hitting prescription medication companies like the company that increased the cost of the EpiPen by 450%, so that we're keeping costs down and affordable for people in America. If we were to repeal it like Trump says, we would have to take away that health care for the 26 million Americans that have received it from this program.
All right, so when you think about Obamacare itself was not a flawed concept. It was a good concept. It was a good idea. The way it was implemented, however, was what went wrong. Now, premiums are skyrocketing. Yeah, I know a lot of people are benefiting from this healthcare, but it was supposed to be the Affordable Health Care Act. People cannot afford this. Premiums are skyrocketing, doubling and even tripling in some states. People were promised the ability to keep their doctor, keep their plan, costs would go down, and illegal immigrants wouldn't be covered. This was promised by Barack Obama back before Obamacare was implemented. Guess what? None of this happened. None of it.
And that's what Hillary has to say, because her plan, may I speak for a second?
At this point, it is not fixable. What we have is not fixable. It's too far down the drain. We gotta repeal and replace with a better system.
You know, that's a great point. Hillary actually does have something to say about that. And what she says is that she's going to start incentivizing it so that the lowest income Americans are able to afford it by having states incentivize the program so that they're more able to appropriately implement it for the people that are needing it the most.
So that's going to fix the damage that's already done. The system's too far flawed right now. It's too damaged to be fixed. We can't fix what we have. It's too far down the drain.
Be that as it may, even though it probably actually isn't, we're at a point where repealing it is not the answer, because that would be depriving those 26 million Americans of health care for that amount of time, or whatever amount of time it would take for a new health care act to be approved. So in that time, what could happen to those people?
All right, so we have passed the point of no return with Obamacare. Has the law been implemented to a point where repeal is unrealistic?
Well, here's where I think people misunderstand some things. It must be repealed and replaced. We're past the point of return, but it's the point of return where it can't be fixed. Obamacare is essentially nothing more than an insurance subsidy. Forcing people to buy insurance solves nothing except perhaps Blue Cross Blue Shield's bottom line. The goal of the healthcare reform was to expand healthcare access. The best way to expand healthcare access is to make it more affordable, not force everyone to buy it. Obamacare isn't affordable anymore, and healthcare under Trump's plan will be. There is no fixing what is already too far damaged.
You know, Hillary agrees with the fact that there are some problems with it, but her plan is far better in the way of fixing it, because it's not repealable. We are past the point of return where you can repeal it. What we can do now is fix it to make it better, because yes, it does need to be more affordable, but that's within Hillary's plan. I think that her plan is the most comprehensive in terms of fixing healthcare.
All right, well, can I cover that?
Yeah.
All right, so Trump's plan, basically, Trump actually does have a very detailed plan on his new healthcare system. He still wants to make sure everyone is able to gain and afford healthcare. The concept of Obamacare, he wants to continue, but he wants to scrap it, rebuild it, and make it better than it ever was before. So first off, he wants to modify an existing law that inhibits the sale of health insurance across state lines. So that means any insurance vendor can sell insurance in any state. This will allow full competition. It will it'll lower the cost of health insurance and increase satisfaction rates. Trump wants to force the companies to sell, not force the people to buy. If the companies are forced to sell and they are selling insurance, the people will have lower rates. Number two, he wants to allow individuals to deduct health insurance premiums from tax returns. Businesses already can, so why can't individuals? So he wants to make sure nobody wants to slip through the cracks. He doesn't want people dying on the streets. So if there are people in need, these people will be immediately covered and helped. They won't have to wait forever to get the help they need. Now, number three, he wants to require price transparency from all providers. Now, he wants to allow individuals to shop for the best prices for all procedures. Now, this makes it less of a hassle, increases the options, makes it less confusing. All this will help lower the prices of health insurance. Number four, last but not least, he wants to remove barriers for entry into free markets for drug providers that offer safe, reliable, and cheaper products. Now, newer drugs that might save lives could enter market a lot faster under this plan. This would allow private sector to flourish while reducing consumer costs and offering more options.
You know, John, I'd like to ask you a question. And I'd actually like to make a point. So the pushback from these so-called people forcing people to buy this care is false, because the pushback is coming from the private sector, the people who aren't covering or providing coverage to these people. The people who forced this to be even necessary are the people who are against and forcing other people to buy it. They're the ones who are creating the problem. So that's a whole other problem in and of itself. And I think that it's very small-minded to suggest that we're trying to force anybody to buy healthcare.
Well,
right.
the goal,
Hold on, John.
To counter that, the goal is we want to force the companies to sell. To solve the problem that was originally created, we want to force the companies to sell, not force the people to buy, which is just raising the costs.
All right. Well, thank you both for your time. I think we'll see John back at some point today, but I believe this is your last time today, Ripley. Well, thank you again. It's been a pleasure. That brings our discussion to a close. Let's head back on scene where Mina Isaac, who has eyes and ears on the polling place. Mina?
Thanks, Tristan. I'm here with Harry Zhang from Mr. Carr's third period AP Gov class. Harry, do you think Obamacare should be repealed?
Yes, I do.
Why do you think that?
I know several individuals on a more personal basis that have told me that it's more beneficial and beneficial, that they would rather take the fine, which is cheaper, than to use or to apply for Obamacare, because for them Obamacare would be more expensive and have lower premiums. So that's why Obamacare should be repealed.
Okay, thank you. We're going to kick it back to Tristan in the studio. Tristan?
Thank you, Mina. That just about wraps up this period's election coverage. Coming up next period, we'll have results from Georgia, Alabama, Florida, South Carolina, and D.C., while another 4 classes stop in to vote. We'll also welcome some familiar faces back to the studio to debate the topic of job creation. That wraps up our coverage for period 3. I'm Tristan Spaneth. We'll see you in 20.